Hey everyone, Dr. Cochran here, physical therapist. I'm here today to talk to you about blood flow restriction training. Just a disclaimer, this is not medical advice. If you are looking to do blood flow restriction training, make sure you reach out to your physician and your rehab professional in order to make sure it's appropriate for you. For those of you that are physical therapists, this is really meant more for the general population, trying to educate people on what blood flow restriction training is in just simple terms that everyone can understand, that is not super heavy on like the researchy terms and those types of things. So if you've ever wondered what blood flow restriction training is, the whole point of it is to allow us as rehab professionals to get a patient or a person to really just continue to build strength at times where they regularly would not be able to because of pain or something like that. So it allows us to build muscle size and strength very similarly to as if we were lifting heavy weights at a lot lighter weights. So for example, in order to really build muscle mass and strength during an exercise, it's recommended that you train at 65% of a 1 rep max. So a 1 rep max is how much weight you can lift one time with a very specific movement. So for example, with the leg press, if you had a 1 rep max of 300 pounds, that means you could do that one time, not a second time at all, and that would be it. So there are ways to estimate this, and we can train at certain percentages of that in order to build muscle mass and not just be doing one repetition of an exercise. With blood flow restriction training, on the other hand, you really only need to use 20 to 40% of a 1 rep max in order to make the same or similar, maybe slightly smaller strength gains and muscle mass gains. So meaning building the size of the muscle as well as how strong the muscle actually is and how much force you can output during an exercise. So this is really cool because a lot of people can't lift weights either the way they used to because of something like knee pain. And if you're having knee pain and you can't squat, you should definitely get checked out by a physical therapist. Make sure that there's nothing mechanically going on with the squat that maybe is leading to it, or that there's not any other issues going on. So definitely go to your doctor, go to your physical therapist. Make sure you get checked out before considering this. But at that point, if it's really just a pain issue and you're getting those other things addressed, using blood flow restriction training can allow you to continue to lift weights, can allow you to continue to make progress, not lose muscle size, and continue to get stronger while you still are in pain, while you get those issues resolved. So how it works is you get a tourniquet that goes around your leg, and not just any tourniquet. They make specific devices for this. And the device will determine how much pressure is required to partially occlude blood flow from going back towards your heart as you exercise. So that means a certain percentage of the blood flow, usually 80% for the leg, sometimes less, will be restricted from going back. This causes swelling in the limb, so the limb physically gets bigger. And it also fatigues the muscles a whole lot faster than if they were not using it in the first place. So basically, using that light weight builds up a whole bunch of, as you exercise, metabolites build up in your blood, which is essentially the waste or byproduct from muscles exercising and using energy. There are byproducts that come out of that. One of them, for example, that most people have heard of is lactic acid. So, as you exercise, you get that burn and that heavy feeling in your muscles. That tends to build up, and then not as much of it escapes. There are a whole lot of other things as well that build up, that create that environment around the muscle. So we have metabolites building up that are building up at a faster rate because the muscle's fatiguing faster, and then the muscle cells are physically swelling themselves, which kind of tricks the cell into thinking it did a whole lot more work than it actually did. And the cell goes, oh shoot, I need to start repairing myself, and I need to start building myself to make myself stronger so that I can handle this when it happens again. That's what happens when we lift weights. So we're just using a lot lighter of a weight to get there because of this external stimulus that we have on the leg. So not only do we need less weight, but those muscle cells then get tricked into, going through that similar process they would as if they lifted heavier weights. And there's a whole lot of scientific research around this and why and how that happens. And, we still don't fully understand everything about it. We have a pretty good understanding of, how this actually can help people in these situations build strength, build muscle mass, for those that are appropriate for it. Now, it's not appropriate for everyone. If you have a history of blood clots and, a genetic disorder that predisposes you to clotting easily, or various other things, it may not be appropriate for you, and you need to get screened by a medical provider to make sure that it is appropriate for you. Which is why, again, this is not medical advice, just explaining what blood flow restriction training is. And then in the next few videos, I'm going to show you a specific device that I have that I use with my patients, as well as how I typically do exercise with patients after like a surgery, or if they're in a lot of pain, so that they can continue to maintain muscle mass and not lose it, and continue to make progress. And typically they get better faster. So stay tuned.